Okay, welcome back to Sports Weekly MN. I'm Duff, and with me is Joe. Joe, how you doing today?
Uh, we're doing okay. World's changing quickly.
Yeah, it seems every day or every hour there's a whole different news story that's important that we just have to hear about. And
Hmm.
at least here in Toronto, often these stories result in things that do affect our lives. So yeah, it's a big deal. Hopefully. So far, most of the news has been related to prevention of spread of the COVID-19. So all sorts of things are closed. I tweeted out earlier today that, or maybe it was yesterday, that well, in Canada we don't have spring break, we have March break, and that takes on a whole new meaning when children are out of school for all of March. Like, no kidding, it's March break the entire month.
I
So
love that they call it March break too, and just are realists. Spring is not sprung in Canada in March.
yeah, exactly.
Oh, and by the
Um,
way, it hasn't sprung in Minnesota in March either. So there's that.
I mean, technically, Joe, you live more north than I
That's
do.
true. I do live farther north,
Your
don't I?
latitude is a higher number than mine. So
I think you're a zone 6 or a zone 5 for growing,
something
and
like
we're
that.
just
Yeah.
we're just zone 4 here. So
Um,
makes sense.
yeah, and some good news. Some of our friends in New York were posting on Facebook about how the New York City public libraries were going to close, and so they were checking out books. And I thought, well, that's probably going to happen here in Toronto too. So yesterday was Friday at about 3 o'clock in the afternoon. I went and checked out over 100 books at our local
Nice work.
library, and 2 hours later, the libraries were closed, like indefinitely.
Wow.
Um,
Good work.
so yeah, that's good because we have at least 3 weeks of no school here in
Right.
Toronto. So
And I think the CDC just came out with, like, be realistic, it's going to be 8 weeks.
I know that's totally crazy.
Hmm.
And I saw one of my teacher friends in Staples. We had to go buy some paper, and excuse me. And the teacher friend, he teaches at a private school, and
Okay.
in a high school. He's a math teacher at a private high school here in Toronto, and they've gone 100% e-learning. So
Yeah.
they're not closing down. So he had to buy a whiteboard and like a video camera and all this like stuff, to be able to teach his classes from his tiny apartment.
Hmm.
And yeah.
So our teachers and our school district met 2 weeks ago on e-learning because it's become a new thing in Minnesota for our snow days, right? They'll have e-learning days.
Oh,
And they
that makes
said,
sense.
oh,
Okay.
we can't do this because there's too much inequity uh, throughout the district for our students, right? Not enough have online learning. Two
Yep.
weeks ago they said this. They didn't even want to really discuss it. And at the time I'm like, guys, this is coming. COVID-19 is coming. The coronavirus, and you don't. That is no planning, right?
Yeah.
No fourth planning. So at this point, we're supposed to go to school on Monday, and it's supposed to be normal.
Interesting.
I don't even want to go to the school. I don't want to leave my property at this point.
Mm-hmm.
Um, for various reasons. I don't want to get anybody else sick. I don't want to become sick either. But I don't want to pass it to anybody else.
Right.
And it kind of brings us into a different controversy of school closures, right? The one thing that I've heard about school closures is that, well, what about the healthcare workers? 30% of healthcare workers have school-age children.
Mm-hmm.
And yes, they do. And that is a controversy. And really, it's the only reason I can think to keep the schools open. Except this. It seems like kids don't, for the most part, are not getting sick from this. If they do, it's very mild generally.
Mm-hmm.
Of course, there's always exceptions. But for the most part, that seems to be the case. But I ask you this, people that are making that argument. if a student comes to school and is a carrier but non-symptomatic, which we've seen is 4 to 5 days generally, and gives it to 6 other kids, because kids don't know how to social distance, especially at elementary.
Oh no!
And
they're like sticking their
now
hands in
those
each other's noses.
kids bring it home to grandma and grandpa, mom and dad, aunts, uncles, whoever. You've just defeated that whole argument. It's gone.
Mm-hmm. Yeah.
Because now there's going to be all those people going to the healthcare hospitals, and now the healthcare workers are going to get sick, right? It's been proven that a lot of the caregivers end up getting sick as well because they're around it.
Yeah.
And so your argument is gone. Why don't we be proactive? Because I also heard this from the president of AFT, American Federation of Teachers, that says if a school district has an employee that ends up with this, or a student, they're going to close immediately anyway, and now there's no planning, right? Because the other argument is, well, what about all these kids that rely on districts for food? Well, last time I checked, we close all summer long, and we feed kids all summer long. So it's not like we couldn't figure out a system how to do that, correct? On a shorter term basis.
You'd think so.
We don't feed the kids for 2 days or something, and then we do a drop-off site, or you hand it to a person in their car. I don't know. I mean,
yeah, I saw a report on I think it was like CNN or something about in Seattle they closed all the schools in Seattle, and they were still doing food prep for students who needed food, and then they would put it in bags and deliver it, basically.
Correct.
Which, I mean, you can't do that for an entire year, but for a couple weeks, yeah, that's possible.
Well, yeah, exactly. I mean, they feed kids all summer long. The food is there.
Yep.
They'll keep ordering it. I heard today that in the United States, truck drivers always have a certain number of hours that they can be on the road. That's been waived federally.
Oh, okay.
Now they really have no limit to how long they can be driving, which kind of gives you different issues, but bigger problems, right?
Yeah.
Everything's kind of weighed at this point. So I think, there's so many schools that have e-learning. Extend spring break for 2 weeks and then go e-learning after spring break. I think that would be a doable thing. It'd give people time to get their plans in place, and I think we could do it.
Yeah,
and I don't know. There's all kinds of issues, but this is unprecedented. We got to err on the side of safety, don't we?
I think so. Yeah, here in Toronto, there's only 63 reported positive cases, and of those, 4 people have already recovered.
Good.
And I thought it was interesting. I was looking up like testing, and in the United States, they've total in the United States, about 15 or 18,000 people have been tested, which, by the way, includes President Trump, who now apparently has tested negative. And meanwhile, in Canada, about the same number of people have been tested, about 15,000. And so that's interesting because the United States has about 10 times the population of Canada. And
we got rid of our pandemic team.
Yeah, exactly. And but compare that to South Korea, where they're testing 15,000 people per day.
Right.
So I think if the testing picks up, I think the number of reported cases is probably going to tick up, which is why a lot of these closings, for example, every sport is just closed now, suspended indefinitely. I think that's a good thing because we don't know. And the reason we don't know is because there hasn't been any testing. 15,000 people out of 330 million is not going to give me a lot of confidence.
No, I heard today that 47 of the caregivers at that facility in Seattle or in the Seattle area at the nursing home. It's kind of the epicenter over there.
Yeah.
47 have tested positive
Oof.
out of 150.
That is really bad.
It's really bad. We have to get out in front of it. They say, well, there's no evidence of community spread. Well, you test nobody a day. You've
That's
tested
right.
like 800 people a day.
Yeah.
I mean,
Of course, there's no evidence. That's the
right.
whole point. You need to start testing lots of people.
Right. So do we want to go into sports stuff, or should we talk Italy and France and Israel and those countries?
I think let's go into sports. So
Okay.
I mean, I probably everybody knows now that like basically every sporting event is canceled. Just
Right.
not even like no fans in the stands, just like they aren't happening. And this extends
there's what, one European soccer league still trying to do it?
Yeah. And I saw the other day there was like one high school game in Fargo. At that time,
Sure.
there had been no reported cases in the state of North Dakota, so probably there was very limited risk there. So yeah, I mean there's but we're talking everything. So professional sports, like college sports, Minnesota State High School League canceled everything.
Yep.
I saw reports that even non-sport things like choir and band gatherings.
Yep. Our district
are just
canceled a
all
fun night on Friday.
Oh, sorry. Go ahead.
Our district canceled a fun night on Friday because it's more than 250 people. But last time I checked, all our schools have more than 250 people as well. So
Yeah. Wow. Yeah. Just crazy. The Baseball Hall of Fame is now closing down indefinitely. So there's a lot of things closing. I think overall it's the correct move. We don't know what all the impacts are. I think economically, the biggest negative impact that a lot of people foresee is for people who work in sports who are not millionaires or billionaires. So these are the people who, serve food at stadiums or the minor league baseball players or people who work in like the bars and restaurants that are around a stadium that depend on those games being played to, have a living. And, these are not millionaires and billionaires. So if they're not working, they're not going to be able to pay rent and buy food or buy toilet paper or whatever. Not that anybody can buy toilet paper anymore anyway, because it's all sold out. So,
luckily, I was ahead of the curve, and the last 3 times I went, I bought a pack.
Oh, that's good. We are well stocked as well, simply because it was on sale a while ago, and so I bought a bunch of huge things. So, not too worried about that. And we have a 1-year-old who still uses disposable wipes. So, or not disposable, reusable wipes. So we are well stocked in terms of bathroom cleanup, and so that's good.
Excellent.
That is good. So yeah, a lot of people are worried about the economically disadvantaged people, or whatever, the people who aren't millionaires and billionaires who are involved in sports, from people who work, the visible people, as well as more the people who are behind the scenes, people who work in the TV and the radio and so forth. Not so much the personalities, but the tech people, for example. So yeah, there's a lot there, and it's been heartening to see that a lot of players are stepping up and donating money. For example, Rudy Goldberg, the guy who tested positive, who just a few days prior had been touching all the microphones, he's donating $500,000 to help.
That's the biggest donation I've seen by a player.
Yeah.
Because I believe Kevin Love started this trend, right? He started it with a $100,000 donation.
Yep, I think that's right. And that's great. I'm glad.
Breaking news. Breaking news. A third NBA player is now tested positive.
Oh, boy.
Christian Wood from the Detroit Pistons. He had 30 points and 11 rebounds against Rudy Gobert on Saturday night.
Oh, boy.
He's had no symptoms and is doing well. Well, obviously, if he has no symptoms. Um, but
Yeah.
that kind of proves our point earlier, right? No symptoms, but positive.
Could be spreading. Yeah.
hmm Sorry, I interrupted you there.
Oh, that's okay. So it's heartening to see the players are stepping up to the plate. What would be more appropriate is the owners
Correct.
stepping up to the plate and doing something. And whether donating money or finding alternative employment or, I don't know, they're billionaires. They ought to be able to help out people who make $5,000 a year.
From what I understand, and I completely agree with that point, but from what I understand from Glenn Taylor is there's some things they got to work out. The city of Minneapolis owns the building, owns Target Center, and they hire a company to run it, and then those people pay, or that company pays the employees, kind of thing.
Oh, like Delaware North or one of these outfits. Yep.
Yeah, so that's kind of going on. So from what I understand, that might be one of the reasons why Glenn Taylor hasn't done it yet, but I would think just make it public.
Yeah, come out and say, hey, we're going to help people. We're figuring
this.
out the details. Yeah.
Yes, exactly. This is going to happen for the employees. We're going to figure out the details as we go here, but nobody's going to miss a check, right? Now, I haven't seen any baseball teams come out as of yet doing this, but remember,
Mark Cuban,
they kind of just closed spring training today. Like they sent all the players home. The Twins did.
That's right. Yep.
And their season doesn't officially start for another 2 weeks. That we know that'll be delayed, or it's already been announced that it's delayed. But at least they have a little bit of time before those employees would mostly be starting.
That's right.
So
most of those people haven't really missed a paycheck yet because they didn't really start working yet. Except for the people in the spring training.
Yeah. So hopefully, this gets figured out soon for them because they absolutely should be paying that money and paid. Nobody should be put in a situation here because they're going to lose their job. And I don't know. You'll have to tell me what Canada has done, but United States declared a national emergency, so that opened up $50 billion worth of funding for states. Minnesota already has a $1.5 billion surplus. So there should be plenty of money to help people that, might be laid off or their business is affected by this unprecedented outbreak. And hopefully that helps a bunch of people out and these billionaire owners can help out these other people that are doing it. They'd probably be able to get some of that money recouped, you would think.
Oh, I'm sure there's going to be some tax benefits for the owners for helping out or something like that, When you're a billionaire, it's hard to make a move that actually costs you money.
This is
there's
true.
Always some way to get that back in a different side, So, so Canada has had an interesting week because the Prime Minister, Justin Trudeau, his wife, Sophie, tested positive for the COVID-19. So they're all isolating for a couple of weeks and whatever.
Now, I heard him speak. It almost sounds like he's quarantining himself away from his wife. Or did I just misinterpret what he said? Do you know?
No, I think they're together. Okay. I don't actually know. I would assume they're together, but maybe not. I don't know.
Because he tested negative, I believe.
That's right.
Or maybe he hasn't been tested yet. I'm not sure. But she tested positive.
Yep. I don't know. But yeah, so I think they're looking at a $10 billion tax package. I think a lot of that goes to businesses here in Canada. But yeah, so Canada fortunately has had about 10 to 15 years to prepare for this because the SARS epidemic or whatever happened back in that was 2003. So 2003, and that like Toronto was the hardest hit spot because the healthcare system was overwhelmed. It wasn't responsive. So they put in place a huge number of public health officials whose sole job it has been for the past 17 years is to study what went wrong in 2003.
Are you talking H1N1?
Nope, I'm talking SARS.
I didn't know SARS was in Toronto. I thought that was always in Asia.
It started in Asia, but Toronto has a huge Asian immigrant community, and so it was brought here very quickly, and then it exploded, and I don't remember the numbers now, but thousands of people were infected and lots of people died. And I do remember, this was before we lived in Toronto, but people were still telling me stories when we first moved here in 2010 about how healthcare workers had to come in. Like, a lot of them tried to take vacation or whatever because they didn't want to get infected themselves. And they were told they could either come in or they could quit, and they would never be rehired again.
Oh.
I mean, it was really dramatic or something along those lines because they needed healthcare workers to help deal with all of the sick people. So the good news
I looked up some numbers quick here, Duf.
Oh, yeah, okay.
SARS 2002-2003, United States 27 cases, no deaths. Canada 251 cases, 43 deaths.
Yeah.
That's just Canadian.
And I think a lot of those are
Toronto. It was an outbreak in Toronto. You're correct.
I think almost all of it was Toronto. Maybe a few in Vancouver, but it was mostly in Toronto. Anyway, so the Canadian government and Canadian public health system has had 17 years to essentially prepare. And now they're implementing all of these plans, which is why everything here is canceled too. I mean, all of the city...
I would assume no churches.
Well, we'll get to that in a minute. But so the schools are all closed. They say for 2 weeks, but they say that's sort of at least 2 weeks. Probably
it'll be
longer.
6 to 8.
Yeah, it could be a while.
And spring break's in there, right?
Yeah, spring break is this coming. March break is this coming week, and then the 2 weeks following. So right now they're slated to go back to school April 5th.
Okay.
I don't think that's going to happen. And then also all of the libraries are closed. All of the community centers are closed. All of the city pools are closed. Anywhere where people might gather is closed. Daycares are closed. The publicly, the city-sponsored daycares. I think private daycares are probably also closing.
Sure.
Most churches are closed. Now, our church... is still going to happen tomorrow, but we only have about 50 people who show up, so I think we're under the limit of, I think they said gatherings of more than 100 people are discouraged or something like that. So,
sure. Are you guys going to go?
Yeah, I think so.
Okay.
And
we are not going to church tomorrow.
Oh, okay.
We're going to find something online.
That's good. But yeah, so it's kind of surreal. People are kind of like, oh, well, what are we gonna do? And so hopefully the weather turns around here, so we can spend a lot of time outdoors in the parks and playgrounds and so forth, and keep our distance from other people.
Right, and you're in a vastly different situation than I am, right? So, for those that don't know, how many apartments are in your building, Duf? Roughly.
Let's see, 20 floors times 10 apartments per floor.
200 roughly?
Roughly 200 apartments. Figure an average number of people is about 3. So it's about 600 people who live in our building.
Okay. And your building space, was it cover half an acre? An acre maybe?
No, more than that. Probably a couple acres.
Couple acres, okay?
Yeah.
So, for example, there is 5 people in my family, and we have 7 acres of land. So, we have little different situations here, don't we?
Mm-hmm.
I've always been happy to live out here in this country ever since we moved out here, but I am not regretting our decision to move to the country at the moment. I'll tell you that.
Say, Joe.
Yes.
Do you have a grocery store in your building?
In my building? No.
No.
Well, I kind of do now. I mean,
Do you have a pharmacy in your building?
no, we don't. Nope,
Oh,
that's
okay.
true.
Yeah. So there are some benefits.
There are benefits. You're correct. There are benefits. I
Um,
do have a little atrium growing, some
oh yeah.
plants right now. Got some broccoli and cauliflower and tomatoes and peppers, and they're all starts though, of course, because you're on March break, and well, I'm in March in Minnesota, so
Oh boy, yeah. Those I suppose are growing under the grow lights in the basement, huh?
yes,
Yeah.
that's correct.
Good. Yeah, very good. So, back to sports, maybe. I think
Yeah,
probably the most exciting thing to have transpired in the last few days is Trevor Bauer has decided
yeah.
to take it upon himself
Oh, and we
to.
should talk about who Trevor Bauer is.
Yeah, okay, so you can explain.
Sure, Trevor Bauer used to pitch for the Cleveland Indians and was traded last season to the Cincinnati Reds. And he is probably the most outspoken MLB player there is in the game at the moment. They call him Trevor Bauerisms. His number is 69 for those that know about that stuff. And he donates money to 69 different charities, and there's a big play on that. So it kind of gives you an idea of what kind of guy he is. But he has decided, based off like someone's question. So
Yeah, so David
I looked at
Carpenter.
Bauer's web. Go ahead, Duff.
Yeah, David Carpenter, a guy named D Carpenter 29 on Twitter.
Yeah.
He twittered Trevor Bauer and says, "Do you think we can get some guys together at a random field in PHX, which I assume is like Phoenix, and have
Phoenix, yeah. He's in the Cactus League.
have a pickup baseball game, Sandlot-style?" And Trevor Bauer says, "I am 1,000,000,000, I don't know, it's like 1,000,000% in." And then he tweets out the little clip on Twitter from the Sandlot where it's like, "You play ball like a girl," and then he tweets out on his Twitter. He has quite a few followers that he asks if there's any major league or minor league baseball players in Arizona who want in on the Sandlot game. Please respond, and at Watch Momentum will organize with you. All pitchers and hitters will be mic'd up. Mandatory. Open to any other rules, suggestions, let me know. So Watch Momentum, I guess, is some business.
It's a business.
Yeah.
Yeah.
And I don't quite get
I think they
their
stream stuff. And
relationship with Trevor Bauer. I don't understand how that works. But yeah, they're like a streaming kind of sports video thing. And anyway, so I guess late last night, Bauer sent out another tweet saying that's confirmed, it's happening. All live streams with this event will be distributed through Watch Momentum and Trevor Bauer's personal channels, so Twitter, Instagram, Facebook, whatever. And he says no further announcements will be made, so follow now or risk missing it entirely.
So I followed it, and from what I assume is you can, it'll be posted when it's going to happen, I imagine.
I guess so. And anyway, so kind of the whole point here is they have a GoFundMe that's associated with the friendly rendition of the Sandlot to support stadium workers and other people displaced by the baseball season postponement. So they're asking for donations. Seems like a pretty worthy cause. Seems like it's going to be a lot of fun. I hope it's safe. And
I would imagine they would do it without people in the stands, right?
Mm-hmm.
Oh, he just posted something now, a minute ago.
Yeah, it says tune in all on Watch Momentum channels.
Okay. All right. I just followed Momentum. Watch Momentum.
Well, so yeah, I'm going to click follow on Watch Momentum.
Yeah, I would imagine that this is it happening tonight?
I don't think so.
Be there, Buffalo butt breath.
Yeah, it's not really clear, is it?
No.
But it's going to be kind of cool because they're all going to be mic'd. I imagine that on Watch Momentum, they probably don't have to keep it clean either.
Yeah, exactly. So, Yeah, so this should be exciting. I don't exactly know when this is going to happen. Probably, I don't know. Maybe it'll be tomorrow. Who knows? That could be exciting.
Yeah, it's not really clear when it is.
Yeah, and there's another story that maybe you've read more about this. I just kind of was getting a little update on it that the spring training camps have essentially disbanded.
Correct.
Yeah, so the players are free to go wherever. From what I understand.
It sounds like for most of the Twins, they went back to Minnesota. I know Buxton stayed in Florida. He apparently owns a house there. And will continue to work out. He didn't say where. I had assumed at the facility, but I don't know. That might be dangerous too if there's people coming and going.
Mm-hmm. Yeah.
I think what the big thing here with COVID-19 is that we have to keep in mind that most people, at least 80% of people that get this, that have symptoms, I mean, there'll be somewhat a percentage of people that'll won't have any symptoms, right?
Mm-hmm.
There'll probably be a few people that get tested and never had a symptom. There'll be a lot of people that have it and won't ever have had a symptom. But it sounds like 80% of people that get it, the symptoms are very minor. It's the other 20% that get it and might need to be at least go to the doctor, at least go in and be checked. I don't know. So I think the hospitals could be overwhelmed.
Yeah, a couple things. First is I read or maybe watched something from a doctor at the World Health Organization who really broke down that 80% number a little bit, and she clarified that 40% of people are truly going to have mild symptoms. So like a cough or something like that. The other 40% so that 80% we divide into two categories. 40% of people with just like really truly mild symptoms. The other 40%, they're going to be in pain. Like, it's not going to be fun. It's going to be like a bad flu.
Sure.
But they don't have to go to the hospital.
Sure.
So we should clarify that when people say mild symptoms, what that means is, yeah, you can be pretty sick, but you don't have to go to the hospital and be put on a ventilator.
Right. Not life-threatening or even have to go get oxygen or anything like that.
Yeah. So, anyway, and yeah, so that's what everybody's talking about now is flattening the curve, right? To not have a huge spike in cases and overwhelm all the hospitals, and like what we've seen in the reports from Italy, for example, or Spain
now.
Yeah.
France.
Mm-hmm.
France basically shut down anything. You can't go out of your home unless you're going to work. And most of the work businesses are closed, going to the grocery store, the pharmacy, or the hospital, basically.
Oh, and France does make one additional exception, and that is to go to the tobacco shop.
Oh, that's true.
Funny. But it's true. I saw that today. Yeah, same in Israel. They've banned gatherings of more than 10 people. Which I'm glad it's not Christmas, Joe. Otherwise, we wouldn't all be able to get together for like a meal. So
if we were in Israel, that's crazy.
Yeah.
I mean, last Saturday, we were organizing my son's birthday party and cleaning the house and getting everything ready. And the Sunday we had the party, and I remember thinking that last Sunday night, I go, I wonder what it'll be like a week from now.
Mm-hmm.
And I didn't think it would be this. This is moving faster than I thought. But I remember thinking that it could be a lot of changes in a week, and it really did. Monday, at school, we didn't talk about it a whole lot. It was kind of business as usual. And Tuesday, all of a sudden, it started popping up in conversations. I didn't shake any hands at conferences. Wednesday, it was a lot of talk. Thursday, it was the only talk. And Friday, I just assumed they were going to close schools on starting Monday, but that hasn't happened yet in Minnesota. So it's pretty much all the talk that has been. I've seen some videos of celebrities and singers making videos with their song to washing the hands, which is kind of fun. And like some fun puppy videos, and trying to relieve people's minds and give a little entertainment that way. Thank goodness we have the internet and can do these things versus 100 years ago when 50 million people died in the world from the Spanish flu. And it shouldn't get that bad because we're able to communicate and learn from our mistakes. We have a little statement here from the Detroit Pistons.
Okay.
Player on the Detroit Pistons who was under the care of team medical staff and in self-isolation since Wednesday night was tested for COVID-19. A preliminary positive result came back on March 14th. Health and safety of our players, organizations, those throughout our league, all those potentially impacted by the situation is paramount. And it goes on to say they're working with medical staff. Individual remain in isolation under care of team medical staff. So we know that player from before, and I don't remember what his name was now.
Yeah,
Shoot.
you mentioned it. Well, whatever.
Yeah, not important, I guess. But Christian Wood.
There you go.
Yeah.
Okay. I guess I don't know. Are we ready to conclude this emergency weekend update podcast of
Yeah, I think
sports
so.
non-news?
We'll see what this week brings. Everyone stay safe.
Maybe we can add "wash your hands" to the outro.
Yes. Sing the ABC song. Or have someone sing it to you. Anyway, stay safe, everyone. And I think these things that I talk about every week about growing our own food and being kind to John 3:16 are important things that we need to remember.